My presentation today will be on fibromyalgia. The simple breakdown of the word fibromyalgia, fibro meaning tissue, myo meaning muscle, and algia meaning pain. Is fibromyalgia chronic or acute? Fibromyalgia is a chronic disorder that is heavily misunderstood by the reason of having many different kinds of factors, which could be like physical factors, environmental factors, or psychological factors. Chronic meaning long lasting, more than 3 months usually. The history of myalgia. It was known as pain syndrome in 1950s. The term myalgia was coined by Smith and Moldavsky, along with the pain points that were considered regions of extreme tenderness that is now used to diagnose the syndrome. And pain points, I'm going to get into it a little further in, but it'll be locations where they diagnose if you are a patient of fibromyalgia or not. According to Marzetti reviewed article, there are 2 to 8% of the general population that are diagnosed with this chronic disorder. So the number is very low. It's very little bit amounts of people. Elevated excitability in the central nervous systems increases muscle sensitivity, which contributes to the experience of pain. The neurocircuit is affected, causing tenderness or pain throughout the body in several locations. The pathology behind fibromyalgia. What happens in the brain? The brain's pain control system is compromised, sending weak chemical messages to the body to calm down pain. The chemical anti-nociceptors neurotransmitters are known as serotonin and dopamine. Serotonin and dopamine block pain signals from going back to the brain. The lack of these neurotransmitters down the spinal cord make mild sensations turn into perceptions of intense pain signals. These are some signs and symptoms that fibromyalgia patients will feel. Some will feel muscle stiffness, pain, joint stiffness, and pain at the joints, fatigue, intestinal disorders, insomnia, mood swings, cognitive dysfunction, hazy and foggy train of thoughts, nothing where a person could lose their train of thought or they can't focus specifically on one thing. Anxiety, depression, sensitivity, inability to perform ADLs, meaning active daily living activities. What is the cause? The cause till this day is unknown, but there are speculations that it comes from physical or psychological trauma. Some genetic factors. Women are more prone than men to develop this syndrome. Age range from 30 to 35 years old is when the syndrome is more often seen. Physical and psychological forms of fibromyalgia. There is inflammation that can occur. Your immune system can weaken. Endocrine could be affected. It could be genetically through birth, psychological through trauma, or your musculoskeletal. And these are just examples of the brain that could be affected. And like chronic pain in the muscles. You can have difficulty swallowing, toothaches, increased noise sensitivity, and then peripheral, your lungs, weakening in the joints, and pain in the bones, and affected digestive system. Disease association. Patients with diagnosis of fibromyalgia often associate these diseases in correlation to syndrome. Some of these syndromes could be infections, diabetes, rheumatic disease, psychiatric, and neurological. Now, these are the points that I was referring to previously. The diagnosis is based on these 18 points and an 18-point grading scale. There's 9 of these points. Each one is worth 2 points that accumulate the 18. The first location is the occiput, which is located in the back of the head. Low cervical, this region. Trapezium, this region. Supraspinatus, this region as well. The second ribs, which will be down here, second ribs. Lateral epicondyle, which will be both those regions. Gluteal, which is back here. Greater trochanter will be on the sides. And the knees, which will be way down here. For this portion of the diagnosis, you become positive as soon as they accumulate 11 points total. It doesn't have to be the full 18. It'll be 11 points, and you'll be past 11, you'll be diagnosed as a patient of fibromyalgia. Glutamate and diet. Fibromyalgia patients displayed elevated levels of glutamate in the left side of the thalamus. Correlation was found between elevated levels of glutamate and pain. Recommendations and change of diet have been put in place for consumption of foods with low glutamate index. Foods with high glutamate consist of dairy, tomatoes, mushrooms, and soy sauce, and processed meats. Genetics. This is genetic portion that can be passed on from parents or from previous grandparents. Mixed reviews on this portion, but the majority of evidence supports that people can be predisposed genetically. Genetics factors in conjunction with environmental factors such as trauma, illness, or emotional stress support the studies. Fibromyalgia consists of a mixture of different altered gene expressions and vary from person to person based on which genes were altered. Examples of genes that can be altered are pain receptors, stress receptors, inflammatory receptors, immune, and mitochondrial metabolism. For the treatment, primary treatments for fibromyalgia is a patient education and non-pharmacological interventions. Some of these treatments are exercise therapy, mind-body therapy, manual therapy, soft tissue, needle therapy, which is like acupuncture, balneotherapy, which is what this lady is demonstrating. It usually consists of floating in the water, and heated aquatics. Both of these two, hydroponics and manual therapy, are beneficial because it'll reduce the amount of impact that your joints receive, and the buoyancy helps out with um, not causing too much pressure on your muscles, joints, and bones. Physical therapy. Patients with fibromyalgia tend to live a sedentary lifestyle due to them being pain intolerant. Exercise decreases stiffness, pain, fatigue, and comorbidities, increases physical function and the quality of life. Daily living activities become less restrictive by doing aerobic and strength conditioning. Older women benefit by doing strength training because it maintains mobility and decreases the risk of falls. This is a continuation of physical therapy. Manual muscle therapy is a part of patients' regimen 75% of the time. Patients' preference because it is painful during treatment but has long lasting effects, lasting more than 5 weeks at a time. Electrotherapeutic modalities show signs of reduction in pain but not in muscle fatigue or strength, which is why a combination of manual muscle exercise and modalities are important. Electrotherapy allows the neurotransmitters to descend from the brain down to the spinal cord, causing the pain levels to decrease. And then these are just my references. And that is all. Thank you.